with my library. I will also expand my NBME section. I have now two 1 hour sessions that I added to it. NBMEs, I would suggest anybody has to take them for school. Try to do old ones offline. Practice how they're written, read them, and assess the answer choices. By doing 10 a day, 5 a day, 40 a week, as you're studying with your QBank and your books, you'll eventually do well on your NBME. So don't expect, many of you can, but don't expect everyone to transition smoothly from UWorld, AMBOSS to NBMEs. They're not easy, right? So if you don't have to do them, don't do them. If you have to, take this advice, it'll help you. Yeah? Awesome. All right, Dr. Mohan, should I give free 120 at Prometric Center as I have test anxiety? So I got to double check if you can take the 120 at the test center. If you can take the 120 at the test center, I would say do so. Because again, if you have some sort of test anxiety, and I know this is simple to talk about and it's common sense, but it's important to bring this up. You have to address it. How? I mentioned it before. So I would say the 120 is an exact representation of the actual exam. You might even see one or two questions pop up on the actual exam from the 120. Not saying to memorize, it's not worth your time. But if you want to know how your experience will be on exam day, it's not the NBME. They're too short. Think about it. NBMEs are 50 question sets. They make you do 100. Then there's a 15-minute break, another 100. The actual test is 40 questions in an hour. The questions on the UWorld and AMBOSS are this long, just like the USMLE. NBMEs are this long. So to answer your question, I would work on my test anxiety by going to the library, going to the Prometric Test Center. The test drive, it's not gonna affect your score. It's just, I think they just give you a couple of questions. You just want to get in there to kind of sit down. And I have a lot of students do that. They actually go to the same test center, 3, 4. There's no limit, by the way. You can buy as many test drives as you want. They go multiple times a week to get over the fact of going to the test center to take the test. So this is very important, by the way, because when you go take your exam, wherever Prometric it is, if you have issues with test anxiety, stress, you get nervous, you panic, it's going to affect your performance. And I've seen many people don't do well. And they come to me after, but they already have an attempt on their schedule, on their record, right? So try that. All right. Good. Awesome. Cool. All right. Let's see another couple of questions here more. All right. How is NBME different from UWorld and AMBOSS? I answered that already. I'll reiterate. AMBOSS and UWorld are the top 2 QBanks you should use for USMLE prep. Done. NBMEs are concept questions. They're usually 3-liners, 3 sentences, and there's more to the meaning of the scenario. Like they expect you to know more of what they're talking about. That's why you do QBanks, then you work on NBME, then you go take the test. Because NBMEs are like, I'll give you 2 sentences, but you need to know a lot of information, versus the UWorld and AMBOSS give you a lot of information. They just got to put it together. All right, cool. This question is a good one. Let me just put my completion here so I keep track of what I answered. What are the most high yield? I'm going to repeat this. Question from the doctor, California. Dr. C, I'm going to call you, right? If he's on board, this is your question. What are the most high yield topics I need to focus on to perform well on step 1? Good question, huh? If you had the answer, which I do, then that's the magic pill, huh? What do I have to study? It reminds me like back in college where I used to say, I raised my hand, like, all right, what do I need to know on the board for the final exam? And the teacher goes, everything I put on the board. It's a very simple question to ask. It's very challenging to answer. Everything I do isn't to waste my time or waste your time. Well, study this and study this. Your time is limited. I only see you twice a week for 1 hour each. So 2 hours a week I see you, right? Some of you I see more because we do one-on-one sessions. So what I would say is Everything in first aid, very decent. It's very high yield. You have to know your farm. Farm is key. Farm is in every organ system, right? Yeah. MOAs, adverse effects, a must. If you don't know, easy points you're throwing away. You literally are lowering your score and you don't even realize it. These are easy points. You just got to work a little bit to get the info, right? Immuno, microbiochem, 1000%. Now, physiology, path, yes, okay, it's all everywhere. But what I decided to do is when I started doing these question assessments and, analyzing these questions live and creating my QBank, I don't want to just make something that exists, something new, right? That's going to also help you all. Every set that I added to the online community is what you need to know. Fair. I go through questions. I select them to figure out, well, they need to know about CHF. They need to know about, arrhythmias and AFib and flutter and a couple EKGs that I picked. So high yield topics, guys. Ideally, as you obviously focus on my videos and you attend these sessions, you'll realize how I pick them. First aid's a good go-to book. Typically, first aid is only 70% of what you're going to see. A combination of your QBank and first aid together will give you the 90%. So high yield topics, Amboss does a great job creating their 200 concepts that are realistically on every step one, and that's in the study plan section. So I've shown you that many, many times. Amboss has certain categories already for you. So if you're at your beginning stage of studying, don't try to, a la carte anything. Take your time, build your foundation. When you're at that level of like, hey man, what I really need to focus on, I show you guys with these questions that I select and I share with you through Amboss. This is what you need to do. For example, we talk about TB drugs. Yeah, Mycobacterium, tuberculosis, right? You have RIPES, the drugs. You need to know the MOAs and the adverse effects. You need to know TB. You need to know how it presents. So when you start doing questions, you start picking up the high yield topics, right? Don't do the anatomy now. Don't do the embryology. Don't even do the histology. You need to get points. That's why I tell you, micro is huge. They go, well, micro starts with an M. It's not one of the P's. Yeah, but you have bacteria, viruses, fungi, parasites. You have drugs for each one. Plus, not only that, this is found in every organ system. You start realizing my thought process. So what I'm going to do is in the next few weeks, I will create a document that's going to put everything in one big PDF, like a high yield that's going to help you guys to gather your thoughts. Pretty much everything that I do in every session, just into a nicer format. Because if you go back and look at my videos and look at my sets that I create, which a lot of you do, and I thank you for that, you'll realize immuno, same stuff I bring up. Micro, same bacteria, same viruses, like HIV. You'll start realizing what topics are important. And then you'll be able to pick for yourself what's most important. I wish I could tell you, don't do this, don't do that. But physio is important. Pathology is important. Do the sets of questions, and then you'll realize exactly what I mean. Yeah, cool. So I hope that's helping you. I know I wish I could give you the easy answer, but that it's hard to tell you what specific to focus on, right? Let's see. Please, could you highlight more on the test drive? Honestly, Doc, the test drive, you just got to go to the website. It's everything. So it's everything set up on the website. The Prometric Center, which is the place you have to go take your exam, you go to the website, you pay a fee, you fill it out, and they allow you to go there. It's 30 minutes. It's not added to your record. It's just basically you're going there to test drive the facility, to walk in. The website actually is self-explanatory, explains everything step by step of what you're going to do, how you're going to experience it. It gives you a little taste of what the test center is all about. Because if you don't do the test drive, you can't just walk in and tour the facility. All right. So I put that information on the on the community, and you'll be able to do that, right? It's like I freeze sometimes, during the test. So yeah, Dr. Mohan, that's why I'm happy you guys are talking about this, because it's important, right? If you're studying all this time, you're dedicating 2 months, 4 months, 6 months, a year plus.